begin the discussion. I see you there, Allison. Thanks for joining us. I know you're out in the community on the front lines as a nurse, taking care of people, and certainly a huge hero that you are. So keep up the good work. So we've got some of our colleagues and friends from the funeral service. Good to see you online as well. All right. So it looks like we're at 11 o'clock. We're going to get started. So we had a very beautiful weather weekend. I know where a lot of us are stuck inside or at our homes because of the stay-at-home order. Only going out for necessities, but that doesn't mean you can't go out in your front of your backyard and enjoy the sunshine, enjoy the weather, take a walk. Those things are all very important for all of us. I think even in my neighborhood, I look around, a lot of people out doing yard work. There might actually be a competition this month for yard of the month with so many people attending to their yards. So make sure you do take that mental health break for yourself. Oftentimes you can find yourself stuck in your home and it can lead to some depression. So make contact with others, whether that be the folks that you're living with or calling people on the phone, but certainly take that into account. So let's jump right in. We're going to talk about the numbers. This morning I released our Monday press release talking about the deaths that we had investigated over the course of the weekend. We had six new positive COVID-19 deaths. All of those individuals had comorbidities. And then we had another death that I'm going to talk about in particular that's going to require some explanation. I'll do that in just a second. That brings the total COVID-related deaths in East Baton Rouge Parish to 27 East Baton Rouge Parish residents. And we're still tracking the 2 investigations of out-of-state residents that we investigated because it's my statutory obligation. So that's 27 East Baton Rouge Parish residents and 2 from out of state. You will not see those 2 out-of-state residents reflected at the state level through the Department of Health's numbers. They will be pushed on back with the states of origin, which would be Mississippi in this case. We did have a case this morning, a very tragic case, and I want to explain to you kind of how that happened. We had a pregnant mother who went to the hospital that was having COVID-19 related symptoms, shortness of breath, fever, etc. She ultimately ended up having to be placed on the ventilator because of the profound nature of the shortness of breath and has tested positive for the COVID-19 virus. Unfortunately, she was her pregnancy, which she was carrying, she went into premature labor and ultimately delivered the baby prematurely. And in doing so, the baby, because of the extreme prematurity, did not survive. The child, as of now, has not tested positive for COVID-19. However, the mother was. But in speaking with the state epidemiologists, we all agree, myself included, and the doctors involved in the care, that this would be considered a COVID-19 related death because of the positive nature of the mother in this scenario. Had she not been COVID-19 positive, had not required ventilatory support, had not had the shortness of breath and the hypoxia that's associated with the virus, likely she would have not gone into preterm labor, and there would have been a different outcome. But this is an incredibly sad case. It is the first case that I know of here in Louisiana. However, in speaking to some of the experts from around the country, we know there have been other cases similar to this in the United States. And so we would hope that this would never happen here in our state, but it has. And we're certainly left with dealing with that issue. So this really brings up a strong point that we should all really pay attention to the quarantine, pay attention to the stay-at-home orders, pay attention to the social distancing and the isolation. We can all be affected by that, and so it becomes very, very important that we pay attention to what we're being told. Having said that, we looked at a lot of the models last week, the predictive models that dealt with what was going to look like, the surge was going to look like here in Louisiana. Over the weekend, those predictive models have changed. We are seeing that there is some improvement in the surge, meaning that we're starting to do what they call flatten the curve. But we don't need to be complacent about that. The isolation, the stay at home, and the social distancing are still very important, actually probably more important than ever at this moment. And I know that's difficult because we all feel like we've been stuck in our houses. We're ready to get back. We're ready for life to get back to normal, to do the things that we are so accustomed to doing. We just need to hold on a little while longer because it's going to be that's really what's going to be saving people's lives, flattening the curve, and preventing further infection. So please, I can't urge you enough to pay attention to that and not get complacent with it. Certainly, as Easter weekend approaches, a lot of us previously have liked to enjoy getting together with family and friends for social gatherings, and now really is not the time to do that, to really take heed in essence of your social distancing. So the last thing I wanted to bring up before I'll open it up to questions is over the weekend, the Louisiana State Coroners Association, which I am the president of, received a spam email that was sent out to all its members requesting that we have gift cards or electronic gift cards sent to the association to assist during the crisis. This by no means was generated by the State Coroners Association. This is the nefarious actions of individuals who are trying to take advantage of others during this crisis. And so I wanted the public to be aware of that. We immediately took action by notifying the members of the State Coroners Association and putting this out to the media so that people would be aware. As we all should be aware of things like that. There are bad people in the world right now that want to take advantage of you, tug on your heartstrings in such a trying time where they're going to ask you to send money. If you are willing to help someone, make sure you check who you're helping first and make sure it is legitimate. Certainly as a community, we all want to be out there and helping our fellow man through these trying times, but make sure that it is legitimate when you do so. So I wanted to put that out there, but the last thing, we're happy to take questions and help anybody through this as we can. Did I miss any questions? No.
Just tell them to submit them and we'll answer them.
Yeah, just submit them and we'll try to answer them as they come across the screen. Of course, if we miss anything, we can always go back and get it after the live broadcast is over. So it looks like NBC has a question. Yes, the hospital, it was about the newborn being tested for the coronavirus. The hospital either has or will do that, but the other important scenario surrounding that is the fact that the concern that this virus could have what's called vertical transmission. It is such a new virus, we do not know if that's the case. I'll explain to you what vertical transmission is. That's when a mother can be infected by a bacteria or virus that is then transmitted through the placenta to the unborn child. and honestly, an easy example of that is HIV. HIV can be vertically transmitted. We do not know if coronavirus or COVID virus is vertically transmitted, and I'm sure the CDC is going to be very interested in assessing this and studying this as we go forward. So the hospital. Just under 22 weeks gestation was another question we got asked. A question is are pregnant women at any greater risk than the general population? They can be. Absolutely, they can be. There are certain things that happen to a woman's body during pregnancy that can put them at risk. I would say, though, that their risk should be taken as seriously as anybody else in the community as far as it has to do with you social distancing and isolating yourself. So pregnant women need to be wary of that. So it's very important in those terms. So the question has come up as the curve flattening. According to the prediction models that we looked at just this morning, it appears it might be. However, these are prediction models. Certainly, the models that we've looked at, and even the country has looked at, where there are upwards of 100,000 people going to die by the end of the pandemic. As those numbers come down, it's not that the prediction models were wrong. It's that the mitigating factors that we put into place were right, meaning that we put you in an environment where we ask people to social distance and isolate themselves and quarantine, and those factors have helped prevent the death toll or the illness rising to catastrophic levels. So I think we're headed in the right direction, but I certainly do not want to share that news with you and all of a sudden you get complacent and decide, oh, well, it's over, I can go out and do the things I'm doing. Please do not do that. Please continue to quarantine. It's very important, especially right now, because this was the time that was predicted to be the surge. And so we need to heed that warning. So I would, in the yard, is it? Yes. I mean, as long as you're not around someone within 6 feet is what we've considered social distancing. I think it's okay. You don't have to wear a mask all the time. But if you do go to an environment where you might potentially breach that social distance, then absolutely I would wear a mask. So wearing a mask to the grocery store or if you have to run an essential errand, absolutely, it's okay to wear a mask. It is not necessarily, the CDC came out last week along with the Surgeon General saying that it would probably be appropriate for everybody to have, something over their mouth. What it does is it protects you from other people that might be infected, but it also protects you, if you are infected, from giving it to other people. So that's why the mask or that barrier becomes very important. The question is about how do we protect our soon-to-be newborn from this horrible situation. It's social distancing, it's isolation. Again, the same things become very, very important in that scenario. And so not being around people who are sick and staying at home or having someone go to the grocery store for you. The same way we would make recommendations for our vulnerable population, the elderly, those with comorbid conditions, would be the same thing we'd say for pregnant women as well. So the question is, what's the likelihood of a 22-week gestation baby from surviving? They can. Oftentimes in normal circumstances, they have saved children less than 20 weeks in a premature setting. Certainly, this is very challenging because of the level of development that child will have at that point. But yes, in a normal circumstances, 22-week gestational children born prematurely can survive. It's unfortunate what happened in this case. I'm seeing a few repeat questions.
Brian Wilson, how do we protect our soon-to-be newborn?
Yeah, I answered that a second ago. I think you protect your soon-to-be newborn by certainly protecting yourself and isolating pregnant women so that they don't get exposed. It is, when you develop these respiratory symptoms, they can create hypoxia, which is a low oxygen level. That low oxygen level can be then transferred onto the newborn or onto the unborn, the child inside the womb, who then is not getting enough oxygen, and things get very precarious in that situation. What's the best thing to do when you work in a nursing home, I guess is the question. Certainly protect yourself. Wear a mask. I know a lot of healthcare facilities, nursing homes, and hospitals have implemented programs where they are screening people as they come into the facility. Certainly, if you are sick, you should not go to work. You should contact your employer and tell them you're not feeling well. They may wish to test you to see if you are positive for the virus, but it's very important that you keep that line of communication over. So a question for pediatric masks. I mean, obviously, if you have a 2-month-old baby, you probably shouldn't go be around many people or even out in public. So I would just isolate that child at home. But I would not recommend a mask in an infant. I would say that you just should protect them by isolating them. Yes. So someone's asking about the mother in the case. We do not have any. I don't have a status report on the mother in the case. Which, according to what I do as a coroner, means that she's still alive. I'm sure they would call us because all COVID deaths are reported to us upon death. So there's a question about how do you keep kids healthy when they're around parents of healthcare workers. So I have that same scenario. I mean, I have children myself. I have a habit of when I'm done in a clinical environment, I get home, I immediately take all my scrubs and contaminated clothes and shoes off. They go right into the washing machine, and then I jump immediately into the shower to clean myself. And then I monitor myself for symptoms following that, so that I monitor myself very closely for fever, cough, and shortness of breath. And certainly try to isolate myself as much as I can and practice social distancing. I do it at home. You just don't sit on the same couch with each other. You sit on opposite couches. But that's a way you can test that. Somebody's asking, did the baby test positive? The answer to that is no. The baby has not tested positive, but they're still investigating that on a state and federal level. If you don't have a primary care physician, certainly there are urgent cares that are available around town that can give you advice or information. I would suggest at this point that you make a phone call. That's usually the best thing. Make a phone call. Let them triage you over the phone. You don't want to enter what's called an endemic environment, a place that's known to have COVID, like a healthcare facility, unless you absolutely have to. Otherwise, a lot of this can be managed over the phone. Now, if you certainly are suffering from symptoms that are emergent, our system is 911. Call 911, have them come evaluate you. But a phone call is the best at this point. So do I think that pregnant women and children are more at risk? It's difficult to say. This is such a new virus. We don't know that answer right now. It's a lot like the guidance that we've seen from the federal government, where they say to us, we think that the virus lives on the surface for 3 days. They don't really know. It could be longer, it could be less. And that's all because this is such a new phenomenon, a new virus, that we don't have all the answers. That's why we have to be super cautious about it, because we don't have all the answers. So taking heed for the recommendations becomes very, very, very important in this circumstance. Somebody asked about people's hands that are breaking out after excessive washing of them. Absolutely true. That can happen. I mean, you can see a lot of healthcare workers that suffer from this because they wash their hands constantly throughout the day. And so certainly using some kind of moisturizer or moisturizing soap after you wash your hands can become important. So how will this pandemic end, and when do we know it is over? It will end when we see a decrease in the number of cases, meaning the number of cases of not only people that have died, but the number of cases of people that are getting sick from it. And that's when we'll know that it's over. Certainly the bans that have put in place right now, there's a federal ban till the end of April, and I think there's a state ban that is mimicking that. It may seem like that's an overabundance of caution. I do not think it is. Certainly, one case is one case too many. So we have to really concentrate on not jumping the gun too soon in pushing everybody back out into the environment. So somebody put out a urgent care clinic that is doing online check-in and screenings for the person who asked if they didn't have a primary care doctor. There's an option for you. So somebody asked, is this the first child COVID-related death? Yes, it is. Everyone else has been an adult. And the ages we've listed in our press releases that we put out daily during the week. And all the adult cases that we've seen have all had comorbidities, meaning they've all had something that the CDC has outlined as being a complication of the disease. Somebody wants to know about taking prophylactic hydrochloroquine. That is the drug that you probably have heard a lot about in the media lately. They do not have any definitive studies that say that it is the drug to use. However, anecdotally, in the times that they've used it, it has worked well. So they think that there are two ways that drug is helping people. Number one, people who are infected with COVID-19, if they get it early on in their treatment, it tends to help in that scenario. But the specific question, and I'll address that now, is there is a thought that maybe even for healthcare providers, taking a dose prophylactically might prevent us as healthcare providers from even getting it or getting a mild version of it. So I think there's a lot more to come on that forefront. If it does become a drug that is available and FDA approved specifically for this use, then I think in future pandemics, you'll see that we can implement that treatment strategy pretty rapidly and early on and maybe mitigate a lot of the complications that we're seeing right now. Do you think we'll have a season for this like the flu? Yes, we have a flu season every year. So that certainly, we should probably implement some of the same things that we do currently. So I'm going to sign off now. Thank you for tuning in. If we missed your question, we will go back online and try to answer all the questions that we can. I certainly want to urge you to practice being safe, social distance, practice your isolation and quarantine, stay at home. This is a crucial time. This is the time we make a tremendous dent in what potentially could happen with this virus if we all just sit tight and heed those warnings for staying at home, not get anxious, not get complacent. So stay safe out there, and we'll be back in touch in the future. Thank you.